Since the advent of dental aligners, a lot of BDS students are confused whether there is still scope in orthodontics, whether the entire orthodontic braces treatment would be taken over by aligners. To talk about that, we have with us Dr. Nikita Baheti today. Dr. Nikita got her BDS from GDC Mumbai. After that, she went on to get the 41st rank in a NEET MDS exam in her first attempt itself, due to which she got into MDS Orthodontics in GDC Nagpur. There as well, she was a university ranker. She is an ex-assistant professor at GDC Mumbai. She is Indian Board of Orthodontics certified. She has cleared her phase 2 exams. She's been the national speaker in NACON Digi INO 2022. She's been the chairperson of the WDS 2022. She owns a patent for electronic wear time recorder in India. She has multiple copyrights to her name along with multiple publications in national and international journals. She has also published a book on the recent advances in orthodontics. And today she is going to talk about the opportunities in orthodontics both after doing MDS in it as well as in after BDS. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Nikita. Thank you for taking your time and joining us. In our last video, we have spoken about clear aligners and their growth in dentistry, because of which we have got a lot of questions asking about whether clear aligners is going to take over orthodontics overall, whether there is scope in orthodontics, and what should the young dentists do. In this video, Dr. Nikita is going to answer all those questions. Okay. So first question for you is, what were your thoughts when you took orthodontics as your MDS branch?
Okay, first of all, thank you for having me on the show. It's a pleasure to be here. So whenever we decide to do masters, we choose the branch mainly based on three things. First, the subject which we liked or we are interested in during our undergraduation. Second, the one which has a good scope, and of course, the one which will help to stand out from the crowd. And the one with the great revenue. So first, liking, yes, orthodontics was an interesting subject theoretically. I never liked its practical aspect, the wire
Straightening
bending,
of
like
wire.
why someone is making me to straighten the wire. So, but let me tell you all that clinical orthodontics has nothing to do with the wire bending. I am practicing orthodontics now more than 5 years. I hardly remember when the last time I have done the wire bending. So that's the first thing. Second, about the scope. Orthodontics is the oldest specialty in the dentistry. And you can still call it as an exclusive branch because our current UG curriculum has a very little orientation about this subject. And it has a huge scope, not only clinically, but also corporate-wise. And the third thing about the revenue. So I came across an article in the New York Times that among the top 10 professions in the world, one is orthodontist. So I had all these thoughts, and based on that, I chose the branch.
Understood. But when you were doing MDS, okay, there was already Invisalign who was having aligners, but it was very niche. It was not all over the papers, and not the common person didn't know about aligners per se. But when you were doing MDS, that's when all these aligner companies came in. You had direct to customer companies, you had dentists providing aligners themselves. So was there any change in your opinion about it? And what is your feeling about aligners? Are they good? Are they bad? Are they ugly? What is it?
So it has been observed that there are times in which particular thing trends and everyone is talking about it. Like few years back, there was a boom in a dental implant. It was placed by many by the without any adequate knowledge and understanding of it. But now we are coming across in the clinical practice more of a failed implant cases and understandably more disgruntled patients. Even this can be noticed in the recent journal publications. Same things are now happening with the aligners. It has been pushed by the aggressive marketing. Like everyone wants to try aligners, undoubtedly. Aligners are revolutionary in orthodontics. They are an aesthetic alternatives to the traditional braces. However, they have their own limitations. Biomechanics of the aligner is way more complicated than the mechanotherapy. Aligners are ingenious combinations of the human as well as artificial intelligence. So we cannot rely on artificial intelligence to do the treatment. To acquire that needful human intelligence, we need to have a thorough understanding of the subject. So yes, this aggressive marketing of the aligner is disrupting the scenario, but this bubble will burst in the coming time, and only those who have a thorough understanding, knowledge about the subject will be able to practice clear aligners in the future.
Okay, so those students who are doing MDS orthodontics currently in first year, second year, or who are giving their exams, so they should not be worried. Basically, that's what you're saying.
Uh, First thing, the scope of orthodontics is extend far beyond this commercialization of the aligners.
Okay,
Orthodontics includes right from growth modification appliances, such as myofunctional, orthopedic, expansion appliance. Then there is a removable fixed mechanotherapy. Within fixed mechanotherapy, we have now the self-ligating system. Then there is an orthodontic surgeries, TMD managements, cleft rehabilitation, sleep apnea, and so on. Aligners is just the part of the removable appliances in orthodontics. At the same time, they have the limitations. Like there are certain tooth movements which are difficult, sometimes impossible to achieve with the aligners because of their biomechanical limitations. Then the success of the aligner depends on the compliance of the patient. Third, cost. Not everyone is affordable that much to the aligners. So that's the first thing about the scope of the orthodontics. And second, like let's consider any other branch of dentistry. For example, endodontist. Everyone is doing root canal treatment. In fact, it is the well taught and understood subject during undergraduation. Still, endodontist will have an edge when it comes to the results. So speciality is there.
understood. So you should, so the students who are doing it or are thinking of it should not have that fear that the aligner companies are going to take over orthodontics as such. If you know your specialty, you can easily stand out. That's what you're saying.
Correct.
Understood. Now, when they were like 10 years or 20 years ago, there were very few orthodontists. Okay, like there were few dentists also. Wherever they used to go, they used to easily get consults. If they opened their own clinic, they used to have a flow of patients rushing into their clinics. But in today's scenario, as dentists have increased, the number of orthodontists have also increased. Okay, so what is your suggestion for an orthodontist or someone who's a student currently to help them stand out in the field? Before you listen to the answer to that question, please do not forget to hit the like button below and do not forget to subscribe to our channel because we keep on coming up with content which will help you take your career to the next level after BDS.
First thing, there are various working options in the current scenario for the orthodontist. First, they can be a consultant orthodontist at the various clinics. Second, they can open their own dental setup. They will have an edge by practicing orthodontics along with the general dentistry. Third, because of this boom in the aligners, there are many job opportunities in the corporate setup as well for the orthodontists. Like keep funding, the companies are opening for the aligners, but ultimately to treat the patients, to plan the treatment, they are and they'll be needing an orthodontist. And of course, in future, they can open their own in-house aligner setups as well. So there are various working as well as job opportunities for an orthodontist in this scenario. Um, that will help.
Understood. So this is about orthodontics in specialty. Okay. You also conduct a lot of aligner courses where you webinars, you even teach the general BDS students about how to go about it. So you've met a lot of them. You were teaching in a college. There also you met a lot of general dentist students who are just freshly graduated and stuff. What is your common thread of advice to those kind of students or just freshly passed out dentists?
uh, for all the students, actually, this message is there. Like whether you do MDS in orthodontics or not, at the end, you are practicing the clinical dentistry. And it's important to have a basic knowledge about this subject because, again, it's the least taught and understood subject in your undergraduation. Like you can be a general practitioner or you can be a specialist from any other branch. Either a consultant orthodontist is coming at your clinic, or maybe you're dealing with certain aligner companies. But how can you rely completely on the others for the treatment of your own patients? Ultimately, it's your name, your practice, which you are building. So, with these beliefs, I have taken an initiative to impart a knowledge about clinical orthodontics with these some workshops so that even in the future, if anyone want to practice orthodontics or specifically the aligners, they will have a basic knowledge about the diagnosis, treatment planning, case selection, certain treatment procedures pertaining to the aligners, and no one can deceive them. So
Understood.
my message is like you should, yeah, please.
No, no, continue.
So something I want to say is that you should know everything about something and something about everything.
Understood. So they should not keep a blind eye towards orthodontics, even if they are not practicing orthodontics, because they should know the consultant who is coming in is doing a good job. He's treating his patients well, because finally it is his name, it is his clinic which is on the line.
Absolutely correct.
Got that.
Because many times it observed that the treatment time, at least you should be aware, like certain tooth movements, how much treatment durations are required. It was observed during my workshops, like the BDS graduate students or even the general practitioners, they are absolutely unaware about these facts. They are completely relying either on consultant or if some company executives are coming and telling that these many trees are required to do the case. But is it so? If you have that basic knowledge about that subject, then it will help you only to develop or further build your own practice.
Understood. So now, since you're taking so many lectures and webinars, how can someone contact you if they want to be interested in learning orthodontics, and how do they get in touch?
So y'all can reach me out on my Instagram or can also email me. I guess the
Okay.
link of it will be available on the your Instagram page.
Yes, so I'll put the Instagram link of hers as well as her email ID on our Instagram page. Please go and check it out. If you're thinking of getting into aligners or you want to know general orthodontics and how do you go about studying about it, then you can easily contact her and learn from her. Thank you, Dr. Nikita, for taking your precious time out and coming and clearing those fears which a lot of people have that aligners would take over orthodontics in general. Thanks a lot.
Thank you so much. I hope this conversation is helpful to all the prospective students who are deciding to choose their branch for the MDS.
I'm
And
sure it
all
will.
the best to all of you.
Thank you. Thanks a lot.
Thank you.
If you like this video, do not forget to check out our video about the scope of oral surgery after BDS.